About 12 years ago, we realized that there was a huge need for behavioral health services around the country, and specifically for inpatient and partial hospitalization services. There was a lack of services around the country, and we decided to start this company to build brand new buildings that were specifically designed for mental health and substance use disorder patients.
The building design for the strategic behavioral health hospitals is very modern, new, and very appealing to the patients. When I started at Strategic Behavioral Health, what I saw was a tremendous improvement in the patients' behaviors and response to treatment because of the setting they were in. The wide, bright windows, the open floor plan really assisted in helping very demented patients calm down and respond better to treatment.
The building is a one-story building, runs about 55,000 square feet, and it's very open and airy. It doesn't feel like an institution, which is done on purpose. We have 10-foot ceilings, 10-foot hallways, carpet on the ground to make it more of a therapeutic environment. Each of our units are designed specifically for a patient population. We have seen patients and staff respond to this physical plant. We've designed it in a way that takes patient flow into consideration and takes staff supervision into consideration. In behavioral health care, sight and sound is important to be able to take care of patients, and we've designed the building that enhances that for staff as well. We have a prototype building that we've been building around the country. We have 13 or so hospitals now and are continuing to grow. We continue to find that this design really helps patients get better and helps staff do the job that they need to do.
The medical staff at Strategic Behavioral Health work very well together as a team. We have both psychiatrists, we also have medical providers, including internists and medical nurse practitioners that help make sure our patients' physical needs and physical issues are being addressed as well.
We believe in partnering with physicians, and the way we do that is a couple of things. Number one, we allow physicians to create their own workload. Number two, we do things like capitate our pharmacy costs. We let physicians prescribe whatever they think is important for the patient and don't get into telling physicians how to practice medicine.
Psych nursing is a very tough job. Some days you go home crying, some days you go home having the best day ever, but then at the end of the day, when that patient has finished their course of treatment, they'll walk out the door and they'll say thank you. And that's why we do it. It is very collaborative. We're a team. We respect each other and we'll have those conversations and decide what's ultimately best for the patient without letting our egos get in the way.
One of the things that's impressed me the most about working at Strategic Behavioral Health over the last several years is that consistently it's always said that the patient comes first, regardless of the ability to pay. So oftentimes we do have a patient that, for numerous different reasons, may not be covered by the insurance or may just lack coverage, and yet we continue to treat the patient and we do what's necessary. And I've always had the support of the hospital to do that and never have gotten pressure to discharge someone because of lack of coverage.
We believe that it's important for strategic behavioral health to give physicians very competent clinicians with which to work so that good clinical information is coming to the physician, because we believe more and better clinical information denotes better clinical decision making.
Strategic Behavioral Health is rapidly growing, and it's very exciting to be part of that growth. There's a lot of opportunities available. I find it an exciting time to be able to treat very ill patients and have very successful outcomes, and we're looking forward very much so to having more people join our team.